Let's move on to our last victim. As in the last two cases, you want to approach the scene and make sure that it's safe, looking out for the hazards that I had mentioned earlier. Again, I'll introduce myself and talk to the victim and let them know that I'm here to take care of them. Outside of getting somebody's leg or arm or finger x-rayed, you will not know if they have a broken bone or a fracture. So you always want to treat for worst case scenario. If she has those three signs, mechanism of injury, point tenderness, and swelling, assume that she has a broken limb. Another way of telling, of course, is if the bone ends are sticking out. Now, if you ever see trauma that's really bad and the bone ends are sticking out of the wrist, the upper arm, or the legs, never push those bone ends back in. Anytime you move the leg or push those bone ends back in, there's vessels, large blood vessels that run along those bones. And when you start moving those bones, you could cut those blood vessels and cause her to bleed internally. As a matter of fact, the major vessel that runs along the inside of the thigh, called the femoral artery, can actually dump upwards of 1,500 milliliters of blood into this pelvic area without you even knowing that she's bleeding internally. And so it doesn't take that much blood for somebody to go into shock or even die from bleeding internally. When you're splinting a leg, you want to try to avoid lifting it up, because anytime you move it, that's going to cause pain for your victim. There is a natural opening here by the leg here and underneath the ankle. So anytime that you're going to put some bandaging material through here, utilize that space. So what I'm going to do is I'm going to tuck this under Lori's leg here, and I'm going to scissor this back and forth. Now what I want to do is I want to splint above and below this joint right here, and I don't want to attach the splint right onto the possible injured spot. So because we might have a broken leg here, we might have a broken leg here, I'm going to put several of these bandages down. So I'm going to put one here, one just below this. Okay, now I'm going to take a piece of wood, I'm going to place it on the inside here, and then what I'm going to do is I'm going to tie this. And so that you can see this, I'll go ahead and put this up here, but again, you would not put it right on top of the injury. The reason I want to put this up here is because I want to show you how to tie this. When you make this tie, when you tie this onto this limb here, you want to put the tie right on that piece of wood. And what that will do is it won't be so uncomfortable for your victim, because when you make this knot right here, if you make the knot there, that's going to put some uncomfortable pressure on there. So I'm going to go ahead and tie that right on that piece of wood here. I'm going to make sure that that's nice and sturdy. I'm going to place this injury right here, and I could loop this through twice as well, so I could make 2 runs and pick up that slack here. Again, this is only if you have to transport this person. Fact is, if somebody can move their foot or their hand, it does not mean that they did not have a broken leg or a fractured leg. So the next step that we're going to do is, if I can put Lori on a board, that would be our best course of action. The best thing is to try to immobilize her, put her on a board, because I might be worried about neck injuries and head injuries. But if I had to move Lori, I could help her up and she could put weight on her uninjured leg. Because if I'm all alone, the only thing that Lori and I can do is try to hop out of there. So by putting this splint on this injured leg there, it's going to hopefully support those bones and not further exacerbate or cause any more damage. So I would help Lori up on her one good foot, and we could try to hop around. I might even be able to put her over my back and carry her out here. If we had some other rescuers, if we had some other people that could help out, we could carry Lori out, and by doing that, we would have people on the opposite sides. We could reach under Lori, grab each other's arms like this, and we could pick her up and support her. Because anytime you're moving somebody that has sustained this type of trauma, we're always concerned about neck injuries and back injuries, again, due to the mechanism of injury. So if she fell or she was in this really bad fight and we think, well, gosh, her face is pale, does she have any injuries up here? She may have that neck injury. In that case, we're going to try to keep her whole back and her head in one place. We're going to try to immobilize that. So we can reach under, grab each other's arm, and lift her out that way. I can throw her over my back, or she can hop out on one foot. In an emergency situation, you got to do what you got to do.